This week, Nation's Business highlights the HIV/AIDS awareness campaign and the fight to reducing it. HIV/AIDS in Fiji was reported in 1989. Today, the number of people living with HIV/AIDS in Fiji stands at around 482, and the number continues to grow.
Our cumulative statistics are as of December last year, 2012, we had 482 cases. And there were about 62 cases last year alone. And with these 62 cases, I mean, they range from children to adults. But the stats have been increasing over the last few years. But one thing to note is, despite our stats increasing, doesn't mean that that we're not doing anything. The reason is we believe that we're doing a lot. That's why people are coming in now and getting tested. Because if you look at statistics now, our main site for testing, where people come out positive is mainly the STI HIV clinics. I mean, they literally just walk in, they want to get a test done for HIV. They offer a test, or they just come in saying, I want to know my HIV status. So when they want to know their HIV status, they undergo the procedures of counseling, pre-test counseling we call it. They get a HIV test done, and then we get the results back, and we've found quite a few positive cases. And even sometimes if they come in, they've had an infection, a sexually transmitted infection, and we provide them with HIV testing.
According to statistics from the United Nations Children's Emergency Fund, or UNICEF, in 2011, 3.3 million people worldwide have died from AIDS. For the Oceania region, 48,288 HIV cases were reported, with Papua New Guinea having the highest recorded case of 31,609, followed by Fiji, 482, French Polynesia, 334, and Guam, 233.
But I can say that the HIV and AIDS epidemic in Fiji is threatening. The threat is because the risks of spreading HIV exist in Fiji. We still have a high prevalence of sexually transmitted infections among the sexually active population in Fiji. If you look at teenage pregnancies amongst young girls, which shows that there is unsafe sex going on, it's still high in Fiji, which means that we have not taken enough precautions. The message has not gotten to the young people in schools and in places where they play and in places where they relax.
While it has been a constant uphill battle against the stigma attached to people living with HIV in Fiji, some have been brave enough to make a stand and speak up for those still silent about their HIV status.
They're willing to come out public. They're just waiting for the right environment. They're just waiting for the right services, for the right attitude. And because we change attitude a lot, depending on our perception on the environment, the fear of the unknown increases. So, and therefore, those who know that they're HIV positive are always in doubt of the attitude of people. They could be nice today, but what about tomorrow? So the fear of the unknown increases in terms of attitude.
Choeli Velati works for the Fiji Network for People Living with HIV, or FJN+, an NGO set up in 2004 committed to raising awareness of HIV around the country and is supported by the Health and Social Welfare Ministry.
When I was told from my doctor that I got the virus, fear and disbelief gripped my whole system. I was so scared and contemplated suicide. The big fear was my family. How are they going to react towards my HIV status? Huh? So when I discharged from the hospital, I came back home with the loads of drugs or with the loads of treatments just to cure the opportunistic infection that I have. And every time that I have to take those medications, I have to go to the washroom in order to keep away or to keep it safe about my HIV status from my family members.
Knowing about his HIV status has made Chiweli determined to speak out in the hope of reducing the number of infections amongst young people. Like many other people living with HIV, Chiweli says attitudes have begun to change due to the awareness programs carried out over the years by FJN Plus and a number of other stakeholders. However, the threat still remains and people need to take responsibility.
I feel normal. But to some certain level, I have that the internal stigma.
HIV/AIDS has left its mark both as an illness and as a source of discrimination, a disease that also has significant economic impacts to a nation like Fiji.
I think we are investing now in prevention and in treatment of those who have HIV and AIDS, but the result going forward is actually positive in that we will keep those people who have HIV and HIV/AIDS alive for longer, so they will continue to produce. But also we shall prevent people who don't have it from getting it, and the country will benefit a lot in the long run. So I think the impact, the way I look at it, what the government is doing now, investing in preventing HIV/AIDS, is a very positive investment that will have many more returns.
Because of its ever-increasing numbers, Fiji's president, His Excellency Ratuepeli Nailatikau, who is also the UN Pacific AIDS Ambassador, has taken a bold stand in supporting zero HIV deaths, zero new cases, and zero discrimination on people living with HIV/AIDS.
Today, we have a chance to end this epidemic once and for all. That is our goal. Zero new infections, zero discrimination, and zero HIV/AIDS-related deaths.
My advice would be for them to pay heed to what the President has said this morning, and they must do their best to see that they are not affected by HIV and AIDS, and we must also work hand in hand to see that we do our best to eradicate or to reduce the problem of HIV and AIDS in Fiji.
It was really important because nowadays, as the President had said, that many youths are affected by such infections. And it is high time that people need to be aware about it, and awareness needs to be made really viable in schools.
Over the years, $50,000 has been budgeted annually by government for the purchase of antiretroviral drugs. Last year, government allocated another $40,000, increasing the budget to $90,000, supporting zero HIV infection and the continuous promotion of HIV awareness around the country.
I'll say the partners in Fiji have succeeded. I have highlighted the role of His Excellency the President. I think that's a big achievement to have a leader who is leading from the front. But the second thing that Fiji has succeeded in is to have a decree on HIV and AIDS which emphasizes human rights, but also to establish a board, a broad-based board for managing HIV and AIDS. I think that's a big success. The third thing I would emphasize is that Fiji is one of the first countries to establish a very strong process of treating everyone free of charge with full cost to the government who has HIV.
The government has taken ownership of that, where they will provide free antiretroviral therapy for the HIV patients. So that's been provided for years, and that is going to continue. I mean, just having a look at it last year, we significantly increased in our numbers of people who want antiretroviral therapy We increased by 110% last year.
In 2011, government passed its first HIV/AIDS decree, supporting affected people through creating an environment where persons are encouraged to go for voluntary testing, counseling and support services, empowering affected people to seek redress from professional bodies and the courts when their rights are violated, and promoting the need for everyone to be personally responsible for their own health and that of others through duty of care. Apart from the changing attitudes, churches have become more understanding towards breaking the silence surrounding HIV/AIDS.
The church's role is really to love them, those who are carrying the virus, and to affirm their lives, to be able to accept them as members of the communities without any kind of discrimination.
Tumberi and Imosi Ratini are both HIV positive and have been advocates for the fight against HIV/AIDS in Fiji. The couple, who are both on antiretroviral drugs, now have 2 children who have been tested negative.
I contracted HIV in 1999. I think then in 2002, HIV was still new. None has come out public with their status, disclosing that they're HIV. There was no positive person as a Fijian, indigenous Fijian, willing to say that I'm HIV and it's here in Fiji, and fight for the rights of people living with HIV.
For Tumberi, support from her parents has been her strength that has carried her through the challenges that others face. She says society needs to have a heart for better understanding for those living with the virus.
HIV positive people can live a normal life as long as they take care of themselves, they come in for their clinics, they get their regular checks done, and they take their medications when the right time is right.
AIDS, all I think is a killer, right? Okay, all I'm gonna say to the young kids, young generation, to be careful what sort of decision you make, whom you're going around with, right? All I'm gonna say is take care of yourself, you know. Don't let the thing get spread. Don't be shy, come upon it to the, talk to someone, talk to your pastor or somebody, who can give you advice on that. So there's nothing to shy about it,
Young people nowadays have to take precautions. They have to be careful with the partners they are choosing. And if you don't want to get infected, choose the right partner.
Fighting the spread of HIV/AIDS in Fiji is everyone's responsibility and starts right at home.
Where does HIV/AIDS education begin? The simple answer is at home, from your parents. Your parents are responsible for teaching you the facts of life. And HIV/AIDS is very much a fact in all our lives these days, whether we like it or not. Parents should by now have realized, after 30 years plus, that HIV/AIDS is not going to go away by just ignoring it and by avoiding talking about it. Now, many of you here today, your parents don't talk to you about HIV/AIDS. You know that. That's why I've made it my job to talk to you about HIV/AIDS.
Only gays and IV drug users were being killed by AIDS. But now we know every one of us could be
In
devastated
1987, Australia screened a television advertisement to inform and alert people of the danger of HIV/AIDS and the impact it has on the nation. While HIV/AIDS is a growing concern for an island nation like Fiji, promotion and awareness campaigns have been the leading method in raising awareness amongst our diverse communities.
Number of cases we see per year generally, not necessarily positive and negative, not necessarily just the positives, but the number of cases that we see per year has been increasing. meaning more people are just coming up openly. And being mindful, these HIV tests is not just done in these clinics, it's been done everywhere. We try and provide HIV testing at every single healthcare facility in Fiji. The hospitals, divisional hospitals, the main tertiary ones, even subdivisional hospitals, health centers, wherever there is accessibility to counseling and testing, we make it available for the general public. It's open. And we have seen increase because people love to, with the knowledge that's been going out, people are doing a lot more testing. And now one of the approaches we've been using is where we go out and do education in the communities. We give them an opportunity to the community to come out and get a counseling and testing done for themselves. So practically not just allowing people to come to the clinics, but taking the services out to them, being a more preventative, proactive approach from the ministry side.
There is no known cure for HIV and AIDS. It can affect anybody. Prevention is the best cure.
We've seen His Excellency really advocate on that. I mean, he's our HIV advocate for the country, and we acknowledge that and appreciate that. And he's been advocating for parents to educate children on these issues, talk about it openly at home, make it a discussion that is, over the dining table or something that you can sit down and talk to the parents with, and be open about it. Because at the end of the day, if parents won't do it, they will learn somewhere outside. And that's the reality of today, that if we don't learn it at home, we will learn the other side of things outside home, which is either school, peers, etc. And that's something that we've seen happening. But it's honestly a huge opportunity for any individual parent to educate their children with the right facts. And at the end of the day, I'd say just take ownership of your health. And that goes not just for sexual health, but generally health. If you take ownership of your health in every aspect of it, it works out well. You take care of yourself, you do the necessary things that's right, and you're well.
These are important points to know about HIV testing. HIV is the virus that causes AIDS. It can be spread through unprotected sex with someone who has HIV, contact with HIV-infected blood by sharing needles. There are treatments for HIV/AIDS that can help a person stay healthy. People with HIV/AIDS can use safe practices to protect others from becoming infected. Safe practices also protect people with HIV/AIDS from being infected with different strains of HIV. Testing is voluntary and can be done without giving your name at a public testing center or anonymous testing. By law, HIV test results and other related information are kept confidential or private. Discrimination based on a person's HIV status is illegal. People who are discriminated against can get help. If you think that you have been exposed to HIV, you should get tested as soon as possible. You may have HIV and have no symptoms for many years. The sooner that HIV infection is detected, the sooner medical care can begin. Do not hesitate. Visit the FJN Plus Drop-In Center, which is situated at the Old Government Pharmacy, Broadwell Road, Suva, or call 3310-958 or 3319-145 or email fjnplus@gmail.com.